One of the sobering facts I tell people in my job is that every year about 300,000 people die of sudden cardiac death. It means that yesterday they were fine and today they have a heart attack and they're gone. And it's sad because if you take those people and you measure their cholesterol, half of them will have normal cholesterol. So people walking around saying, hey, you know, my cholesterol's fine, nothing to worry about. Half these people who died suddenly had normal cholesterol. And 2/3 of these people, if you did an angiogram of their arteries, you'll find out that they only had a less than 50% blockage, which means if they took a stress test, they'd pass their stress test a week before they had their massive heart attack. What we're trying to say is that exercising, having no symptoms, and having normal cholesterol is not enough, that there are other things going on that could lead to people having heart attacks and sudden death. And what we have to realize is that atherosclerosis, or the disease which causes arteries to block, is a chronic inflammation that happens. And what we realize is that if you measure inflammation, you kind of get an idea what people's likelihood of having a heart attack is. It's almost like looking at your engine. Some people run their engine in the red, some people run it sometimes in the red. That kind of is like a gauge of how we are in terms of our process of inflammation or process of atherosclerosis. So to do that, we want to try to find a good test that'll give us like a barometer, like how hot are we running? What's our risk? And the problem is no one test can really give you a great estimate. So the idea of the PULS test is that they looked at 200 proteins, and out of 200 proteins, they picked 7 that are predictive. And it's a great way of looking at people that have normal cholesterol, that are thought to be low risk, and based on their inflammatory score, their PULS score, you could say, wait a second, your cholesterol says you're low risk, but your PULS test says you might be medium or high risk, and that'll make us look further. If you took these 300,000 people that die every year, you did a PULS test on them, chances are you're going to find in most of them abnormalities that would make us say, hey, you know what, let's check for atherosclerosis, let's check for coronary artery disease. So that's what's, I think, very revolutionary, very exciting about this test, because it's a simple blood test that you can give to people and let them know that, hey, you know what, you think your cholesterol is fine, you think you're feeling fine, but now we found a marker that could tell us that maybe there are things going on the inside that you may not be aware of. And I think that's the breakthrough here.